got a special emergency call from the police department down in Orange County, and 5 officers are down, bad backs. Need to go help them out, okay? So we're on our way down to the OC, trying to help out some officers, some law enforcement, so that they can do their job protecting and serving the community. See you guys soon. Tell me what brings you in.
So the last 3 years, we've been having a problem with our L5. I guess I was diagnosed with a bulge disc.
L5 bulge disc.
Right.
Okay.
Not a big deal, but where the bulge is, it's hitting some nerve, and I don't know what nerve, but it's causing this ongoing pain through these years.
More down the left side, more down the
Left
right
side.
Left side.
Yes.
Work related or life related?
Work related.
Okay.
Accumulated been job too long wearing those gun belts.
Those gun belts can get you. So here's what I found last time when I came out. Last time I came out, we saw about 22 officers. Yep.
Okay.
Of the 22, 20 of them had right hip problems. One of them had a left hip problem. And one of them had no pelvic problem, hip problem. And here's what we found. Everyone who had a right holster, right gun holster,
Right.
on the side, sitting in those Crown Victorias,
Mm-hmm.
propped up like this,
Right.
3 to 5 years, the ligaments remodeled. Everyone's sitting up like this. That one guy who was a lefty had the left one high. And there was only one guy who didn't have a pelvic issue, and he did something different. He had his holster at the front.
Oh, swivel.
So he got himself a swivel off of Amazon. He's the only one who didn't have a hip issue. And it's kind of important. It's something we actually want to share with people. And the reason why is, what if that one little thing will prevent a lot of work comp stuff?
You know, funny you say that. Within the last 6 months, I switched from the standard holster to the swivel. So when I do have to sit in the car, what a difference that I can have that.
So you do it.
And I can, yes, I've recently switched, and that was a huge difference.
Yeah.
And also with the holsters, of most people, they're kind of like a curve shape, like a clamshell.
Correct.
And if you're like anybody who's a normal size like me, or with the weight and the width of those seats and the computers in the room, that ends up pushing into your hip. And a lot of times I was noticing during my shift that my leg was going numb, something, and stuff like that. And getting just a simple investment into buying that swivel and getting it's level now on the hip here, and it drops, and just having it on my leg makes a huge difference.
So does it make more sense, officer, then? Does it make more sense to change all the car seats in all the cars? Or would it make sense to just, hey, through HR or something, let's just change the holster?
The easy fix.
Is it gonna, now let me ask you from a functional standpoint, right? From a functional standpoint, is it gonna be harder for an officer to do their job?
No.
This is a big deal. I didn't even know that he used it, so this is actually really cool information. And we just want to share it. Now, let's get to your case. We have L5 is the major.
That was the first year in 2017.
And was it a specific injury that you did, or was it just over time?
It was presumptive, and what triggered it finally was I was trying to have a normal life with my teenager kid who challenged me to a basketball game.
Okay.
And I called him on it, and it was just a sudden move to the right or left, I forget. I think it was to the right, but right away I felt the pain on my left hip, and I powered through it that day.
Okay.
Then the next day I woke up, I couldn't walk, I felt like an old man, so I'm like, oh, we just need to go back to the chiropractor and get readjusted.
So you've been adjusted, you've been getting adjustments. Okay.
So unlike this time though, the doctor, he looked at me like, wow, you messed yourself up. I've gone through epidurals, which it seems like I'm on my year anniversary. They're good for about a year, and here I am right at the same mark again where my back just recently went out. But the last time in 2018, I also now tore open my S1 by the tailbone.
Okay.
And then still the damage there on the L5.
So that you know, L5 and S1 all relates to the same disc.
Okay.
So L5 is the bone on top, your fifth lumbar, then you have the sacrum on the bottom.
Okay.
The disc in between there is your fifth lumbar.
Okay.
So the idea and what we need to figure out today, is it your 5 that's gone back, or is it the sacrum that's gone back that's taking the disc with it? That's what we'll figure out today.
They have an urgent care. I have to wait till later on to go see the orthopedic, but at that time, the doctor there, she gave me a shot to help with the inflammation.
And when was this shot again?
Last Monday.
Okay, so all right,
And now I'm scheduled this coming Monday to get another epidural, because now they're like, oh, it's been a year. But at some point in my life, yes, they work, but I'm getting frustrated where I don't want to be waiting every year to have to do this epidural.
And we don't want a Band-Aid now, we want a fix.
I want a permanent, yes.
Okay. The one thing, guys, I did forget, we were in such a rush to get down here and help them, I actually forgot my scope today. The scope is one component of the exam. It is a very cool component, but it doesn't mean we can't help somebody without the scope. Life happens. So we're going to spend more time on visualization, on static palpation, motion palpation, and determine how we're going to help him today. Now, is this your normal walk? Because you're a little guarded today, sir.
No, this ain't normal.
Okay, is this your normal today?
No. Let's see.
So why are we walking like this today? Because of pain?
Because of pain in my lower left area.
Lower left. So I want you to notice when he's walking, he's antalgic away from the pain. So he's tilting towards this is what's interesting. The pain is on the left, he's tilting to the right side, okay, on the bottom, but then he's immediately tilting to the left to try to compensate back. Now, the feet are going to give us a lot of clues. They both go out when you watch his feet. Keep walking, sir. And if it's too much, you let me know, okay? So he has a high left pelvis. He has a little bit of a short leg. You look at this crease here and this crease here. They're different at different heights because of the alignment. When we look at him here, I'm just going to be looking at your dimple, sir. So his left dimple is a little bit higher than the right. When I cover him up here and you look at his glutes, I'm not getting fresh, sir, I'm checking your glutes. The left side is a little higher and it's a little bit flatter. Tells us we have an AS, it's gone up and in. I see you making a fist, dude. Come on. So we have a potential left pelvis issue and or sacrum issue. Let's visualize what's going on here now. Now, let's look at the top. Right side is higher. Right shoulder is more anterior. Is it more anterior from misalignment of the shoulder, or is it because of the condition of the spine? When we're looking at it from up top here, we can see some differences. We can see this side is a little bit higher, okay, and flatter. The spine goes straight, and then right around here, it starts to twist. It twists like this, okay? We're going to check general motion of your sacroiliac or your SI joints. Feet touching, feet together. Open and close your knees with your feet touching, please. Open wide, close. Is anything bothering you when you do that? Left side? Okay. This is... Now, do the right side only. When he does the right, the entire left pelvis shifts. Guess what everyone missed, officer?
Why?
You have a left pelvis issue. That's why your sacrum L5 ain't holding. Now, I'm doing static palpation along your spine, and just from what I've done here, your whole spine is red. It's called a hyperemic response. 2 reasons. 1, we need more water. We're dehydrated. 2, if you have enough water, then it means it's a B1 issue. I'm going to assume water.
Be a safe bet.
Yeah? Gallon a day. That's kind of that would be your standard.
Okay.
Okay? And that means you don't drink down a gallon right away, but you drink it throughout the day.
No problem.
Now, as I'm running my fingers, watch my fingers closely. Right there, it starts to shift. The edema is pooling, orange peel skin right to there. Tender there, sir?
No, yeah.
How about this one on top?
More of that one.
That one. How about this bottom one?
Okay.
Okay, so we went off static palpation visualization. You can still see when I push there, that's called pitting edema. That area is around T6, T7. Guess where we got some major, where these nerves go? Stomach and pancreas. Digestion. Let's count. 1, 2, 3, 4, 5, 6, 7. That's T8, sir. That's T7. That's T6. Not 6. 7's tender. 8's more tender. How's 9? T8. So T8 is a major. Left pelvis is a major. Let's check L5S1 for you now. This is 5. It's hot. I don't need to go hotter, more than that. That's hotter, yes?
Yeah.
Okay. So we have 2 issues. We have sacrum, we have pelvis, we have T8. Okay. Starting at the base of the neck. That's T1. 7, 6, 5, 4, 3 is tender on the right side there. You feel that, sir?
Yes.
And then I got the atlas on the left. C1, C3, T8, S1, left pelvis. Ready? And I'm going to do C3 prone, and I'm going to do, basically I'm going to do all of them here except for the pelvis. C3, tummy up and down. That's a home run. Gotcha. And now we're going to do your atlas. C1, ASL, beautiful. As you're walking, taking some nice deep breaths, sir. Good. Good. We need to go back down to do the sacrum now. I'm going to be on the sacrum slightly to the left. I got you the whole way, officer, no issue. Nice and easy. That's a home run, my friend. I got you. That was crunchy, spicy, sweaty. That's a home run, my friend. Come up slowly. You just keep walking, sir. That's the game changer. His antalgia is disappearing as he's walking. Your tilt is disappearing, by the way. Do the right side only. Look at that, officer. You feel that?
Yeah.
The left's not going now. Do the left side. Do you feel that? Tell me what you're feeling when you do the left side.
I don't feel a shift. The only thing I feel is...
You feel the muscle down here?
Yeah, right in there.
In the glute. Okay, right side only. Okay, so here's what I'll do. I'll bump it lightly, okay? Let's just get it going and have you walk. From the PSIS, 2 inches lateral, 3 inches inferior. That's the spot. Gonstead called that his spot. That's the spot for the ASIN. No pun intended, that's the Gonstead spot. Now, happy space. Happy space, happy place. You're tightening on me. Gotcha. Home run.
The pain level is, what I said before was like an 8-9. I say it's way down to maybe a 2-3. Very.
Can you take a little more? Let's get the rest of it.
We're here?
We're here, let's do it. So, just a little more oomph with a little more torque on the end. The torque is to get the last bit. Belly button down. All the way down, sir. Gotcha. That's the grand slam, my friend.
Oh, man.
So the waddle's gone. I like it. Come back over here, have a seat. Over, let me do the work. Baseball pitch. Over, around. I'm holding the elbow and bringing it back that way.
Okay.
This side, over, around, down. Look up, please. There you go. Let's go on your back. Anterior talus, medial tilt, tender right here. Yeah. Posterior fib. There you go. Setting the elbow, radial head, PL, posterior lateral. There. Distal radius. A little more. And lunate. From, squeeze my hand. Squeeze. Radial head, distal radius, lunate. Breathe. Gotcha. Squeeze. Let's not forget the ears. Okay. So, you have homework now.
Yes, sir.
Walking, water, ice.
Okay.
Your issue is your sacrum and your SI joint, but mainly is your S1 slightly to the left.
Okay.
That's the main issue.
The sacrum?
You need that. You don't need injections.
Okay.
Ice the areas. I would be icing 2 to 3 times a day. First thing in the morning you wake up, slap an ice pack on your low back, go brush your teeth. Leave it on for 10-15 minutes, do your morning stuff, and then take it off. What that's going to do is tighten up the muscle to hold the adjustment so you don't injure yourself in the morning. End of the day, slap an ice pack on. If you have time in between at work, even better. Ice is your best friend.
Okay.
We need to figure out if we can get a few adjustments on you. I think we can change this all around
Okay.
better than you think.
Perfect.
All right?
Thank you, sir.
You're welcome.